we're back this morning. Dr. Lauren Stokes is with us. She's hosting a parenting seminar for kids with special needs. It's coming up on Thursday.
Yes.
So Lauren, welcome to the show.
Thank you. Thank you all for having me. Yeah, I'm really excited about this. This need became known to me through a lot of the families that I treat who have kids who have any kind of special need. Lots of times we think of special need as maybe a medical diagnosis, autism, cerebral palsy, but I also include in this, ADHD, behavior problems, anxiety, social skill deficits. And the things that I've been hearing from parents is none of our traditional parenting strategies will work.
Right.
We've tried this, we've tried that, we've switched around, and it's just not getting us the success we need for our kids. So these approaches are very specialized to help parents learn to focus on a couple of different things that maybe they're not used to focusing on to try to bring about better behavioral functioning for their kids, whatever the special need might be. Right. So it's going to be a broad kind of topic to talk through several different strategies to hopefully kind of open the door for them to start using some of these.
Well, that's great to know because it is much needed in the community because a lot of times parents know to medicate for ADHD and special for that nature.
Right.
So you're given different approach.
So these are parenting hands-on strategies that can augment or support medication or be in addition to or instead of, but things that caregivers can use, teachers can use. So hopefully trying to reach a wide audience to be able to help families.
And what is age range for the children? I mean, when is it best to begin with the training and
it kind of depends on the need. I think, for me personally, when my daughter was starting to talk, that was when I started noticing, okay, I've got to kind of start shaping her and molding her. So I think it depends on what's going on. For kids with autism, for example, you might start to notice that sooner, speech delays, some behavioral function difficulties. Kids with anxiety usually tend to present more kind of school age. So it kind of depends on the child, and sometimes the best entry point to asking these questions is with your local pediatrician. They can kind of help steer you in the right direction. Of course, I'm available as more specialized to be able to talk with families too.
Now, where's your office?
It's located on Calais Circle, which is right across from BJ's Pizza, off the Jackson Street. A favorite, right? Yeah. So I've been welcomed into the practice with Dr. James Quillen, who is a medical psychologist in town, has been around for years, has very good expertise in medication management. I don't provide medications, I'm the therapy side of it. So we share a lot of patients, and I've partnered with Cabrini, who's invited me to do this talk, Cabrini Pediatric Therapy Center, because they have a lot of kids who have a lot of special needs, and they're focused on speech therapy, physical therapy, occupational therapy. Right. So I can try to add in this other wraparound side of psychiatric, psychological.
Parents of kids with special needs, I'm sure they're looking for guidance, need information to help them with their parenting.
Yes, it's, we all struggle with parenting. We always go to bed at the end of the day thinking about what we could have done better, what we could have done differently. And for kids who have special needs, that's an even greater challenge because they present unique needs. So it's trying to identify those needs, try to get some support for families because it's very, very tough. So I try to hit the A's, B's, and C's of parenting. So A is meaning attention, what you're focused on, positive attention. B is for that behavior control, trying to do different techniques that are going to help. And then C is for care for yourself because parenting is hard.
It sure is.
It's one of the most difficult jobs, if not the most difficult job.
It's the most difficult job.
But it's the most rewarding too, I think.
At the end of the day.
Yeah, at the end of the day.
And this is a free seminar.
It is free. Yes, it's free. It's open to the public. This Thursday from 6 to 7:30. We're taking RSVPs. You can call Cabrini Pediatric Therapy Center. You don't have to RSVP, but we're just trying to get a sense of who's going to be attending. Yes, sir. So we welcome anybody that would like to come and just get some information.
Thank you so much for being here.
Thank you for having me. I appreciate it.
Good
Thank you. Thank y'all.
And we'll wrap the show up when we come back. Stay here.